Hello, it's Dr. Rachel Brown, Medical Director of Wellness and Prevention with Employer Health Services at Prisma Health. And today I'm going to be talking to you about prevention and health maintenance. In other words, what sort of testing and studies and assessments do we need to undergo to prevent cancers, to prevent chronic disease, to prevent other illnesses? So I'm going to jump right to it and share with you some slides. And we're going to start with cancer screening. So this is the question I get asked most often. So we're going to begin with what do we do to manage colorectal cancer, breast cancer, cervical cancer, lung cancer, prostate cancer, and skin cancer screening. Now remember, this is different from diagnosis. Screening in all cases, whether it's cancer or for other illnesses or chronic diseases, means no symptoms necessarily are occurring, nothing that makes you concerned that you have one of these things, but how do we detect any problems early so that they can be treated early? So let's talk about colorectal cancer first. That's for those of us who are in our 50s, although the recommendations have changed. So the screening interval starts at 45, so maybe you are up to PlayStation by that time. Here's what we have for colorectal cancer screening. The USPSTF, which is the United States Preventative Services Task Force, recommends screening for everyone for colorectal cancer between the ages of 45 and 75. That is new. The age used to be 50. It has now been lowered to 45. And we have several tests that are available for detecting colorectal cancer early before symptoms have started. So the first most of us know about is colonoscopy. Now, there was a test called the flexible sigmoidoscopy. That's really fallen out of favor. We don't see many people doing those much anymore, but that colonoscopy is the gold standard. The problem with it is if any of you have had this done before, you know there's a pretty extensive prep that has to be done to make sure that the bowels are cleaned out, that this does happen under sedation, and so you may be out of work for the day. You might need someone to help drive you home, that sort of thing. But it's an outstanding test, and if everything is fine, you can have this one done every 10 years. If they find something a little bit suspicious, maybe they ask you to come back every 5 years. Or if they end up finding a polyp, even if it's benign, they may ask you to come back in 3 years. But fantastic test if you're trying to screen for colorectal cancer. There's another test you may have heard of called Cologuard. And of course, there's also fecal blood testing. And this is in looking for hemoglobin in the stool, looking for blood in the stool. The difference between the two is that Cologuard is actually also looking for some DNA markers as well as blood in the stool. And the advantages here are that these are tests that can be done at home. They're very easy to do. However, they are only for folks who are at lower risk or moderate risk for colorectal cancer. So if you have any significant risk factors, such as a family history, these are not the tests for you. Also, if they are normal, the interval for rescreening is much more frequent. So it's anywhere from 1 to 3 years, 1 to 2 years, depending on the results. If either of these tests are positive, then of course you're going to have a colonoscopy anyway to confirm and possibly diagnose or intervene to screen for that colorectal cancer. Okay. Let's talk about cancer for a moment. The USPSTF recommends biennial screening. So that means every 2 years having a mammogram done between the ages of 50 and 74 years old. While men do get breast cancer, there are no standard recommendations for screening in men. And there are still women and providers who may send women not only for yearly mammograms, but also younger women for mammograms. And it really has to do with what your risk is. So for instance, if a young woman comes to me, maybe she's 40, maybe she's 45, and she has a very strong history of breast cancer in her family, then I'm screening her earlier and more regularly on a yearly basis than I might someone who's 50 years old, has no family history of breast cancer, has factors, then I may screen her every 2 years with mammography. Some of you may already know this, but often they will offer a 3D mammography option. This is usually covered by most insurances as part of the screening package, and that can help to determine whether or not women who have breast dense tissue dense breast tissue have anything irregular. Sometimes it's difficult to see on traditional mammography, and so that 3D version can help pull out some irregularities with a little bit more clarity. All right, let's move on to cervical cancer. A little bit more detailed recommendations here for cervical cancer. Let's start by talking about the vaccine that can prevent cervical cancer. So the HPV vaccine is a vaccine that targets several human papillomaviruses that have been known to contribute to a higher risk of cervical cancer. And so we are recommending that girls and boys age 11 to 12 start to get those vaccinations so that boys do not infect girls and then increase the girls' risk of cervical cancer. If you're older than 11 to 12 and you haven't had your HPV vaccine, there are some recommendations for older folks going ahead and getting that HPV vaccine, but that's going to be our primary prevention for cervical cancer. Now, in terms of screening tests for cervical cancer, of course, we know that the traditional test is the pap smear. We have also added the ability to test for HPV when we do that vaginal exam. So for young folks age 21 or younger, there's no screening required, okay? If someone is 21 years old, they can begin to have pap screenings every 3 years, and we don't recommend HPV screening. HPV is very, very common, and we don't want a false positive test or a positive test for a type of HPV that may not contribute to a high risk of cervical cancer or may resolve on its own to complicate the picture. Now, once a woman reaches the age of 30, then that pap test is recommended again every 3 years. Or if you do a pap test with the HPV testing and your provider can tell you which one they're doing, then you can space your testing out, your screening interval to every 5 years. At the age of 66, or if you've had a hysterectomy removing the cervix not for cancer, in other words, maybe fibroids or some other reason, you do not any longer need cervical cancer screening. So women over the age of 65 do not need to have any more pap tests done. All right, let's move on to lung cancer screening. This is actually a fairly recent, within the last decade, recommendation from the USPSTF. We weren't exactly sure the best way to screen for lung cancer in the past, but we know now that there are special CT scans that we can order specifically to screen for lung cancer. So who should be screened for lung cancer? Well, anyone between the ages of 55 and 80 who are either currently smoking or who they say recently quit, and recently means in the last 15 years. So if you quit 20 years ago, 25 years ago, you would fall out of this category. However, if overall you smoked for more than 30 years, and that could be 1 pack per day for 30 years or 2 packs per day for 15 years, then you fall back into the screening algorithm, and you are someone who should get this special CT scan. Of course, the most important way to prevent lung cancer is to not smoke. Okay. If you have a family history of lung cancer and you're a non-smoker, talk to your provider about screening. You also may fall into the category of someone who needs to be screened, even though you don't have a smoking history. Now let's talk a little bit about prostate cancer. So prostate cancer is also a tricky one. The USPSTF actually recommends that this start with a discussion with your provider. This is because the prostate screening test, which is the prostate screening antigen or PSA test, does have a higher rate of false positives and a higher rate of false negatives than some of the other screening tests that are recommended. And so it's important for someone to understand that just because the test is positive doesn't mean they have cancer. It may be something else. It may be normal aging. It may be a prostatitis, an infection. It could be just hypertrophy or enlargement of the prostate. And they need to understand that a negative test doesn't necessarily rule out cancer, but that watching that PSA over years and watching the trend, whether that number goes up or stays stable or even goes down, can be very informative in evaluating risk. But certain things like family history, race and ethnicity, also age, also contribute to the risk. And so talking with your provider to know when's the best time to screen is really the right route. So you can see here, folks who have a family history really should start considering a PSA test at around the age of 40. If you have not had a family history, but you're African American, the screening interval is a little bit earlier, or screening start date is a little bit earlier, because African American men are at higher risk for prostate cancer. In general, we say almost all men should consider prostate cancer screening around the age of 50. And then, of course, as you get older, and certainly over the age of 70, we stop screening. You talk to your provider about this. It depends on family history and when the gentleman in your family got prostate cancer, whether they were older or not. But it's a little bit not as cut and dry as some of the other prostate cancer screening. And so please talk to your provider about this. He or she will know the best time and interval for screening. And then finally, let's talk about skin cancer. So a lot of us will visit the dermatologist or even our primary care provider for a skin survey, where our entire body is checked for any sort of at-risk moles or freckles or lesions. The USPSTF doesn't necessarily recommend that we do a skin survey every year. In other words, they have not seen that necessarily changes the course of disease or adds a benefit. Still not a bad idea to do, right? Certainly if you're there visiting a provider on a yearly basis and want them to check a few moles and make sure that nothing seems amiss, then it's not a bad idea. However, they do recommend counseling from your provider. So your provider will talk to you about how to minimize that UV light exposure. And this is especially important for folks who have fair skin types, or blonde hair, blue-eyed folks, lighter skin folks who may be at even higher risk. So there are some things that you can do to change your risk, and you see them here in this category, in this column. Limiting your sun exposure, although having some sun exposure is very, very good for you. It's very good for your physical and emotional health. We do need vitamin D, and we need to get that through our skin. Obviously avoiding sunburns. Believe it or not, that HPV virus that we talked about before can also be associated with skin cancer. Avoiding tanning beds. And then there are certain products that contain arsenic, coal, and tar that can also increase your risk of skin cancer. If you're in one of these non-modifiable categories, in other words, you're fair-haired, light eyes and hair, you have a lot of moles, maybe you have family history or personal history, males are at higher risk, and folks who have a diagnosis of psoriasis have higher risk. Not a lot you can do to change those things, but you certainly can be aware that you need to be more protective when you're in the sun. So wear protective sunscreen as well as clothing, and avoid sunburns for sure. All right, let's talk about screening for diseases. Now, there are many of us that wish we could walk into our provider's office and say, just check me for everything. Do every test you can think of. Tell me if I've got anything. And that doesn't make a lot of sense. There's no way to do that, first of all. But also there are some cases where the test is going to actually likely cause more problems than solve problems. If they're negative, sure, that's wonderful. But if it's positive, then you're going to have to go down the road of more testing. And some of these tests just aren't accurate enough for us to willy-nilly sort of test everyone for every disease without any sort of symptoms or indication that they may have a particular condition. However, there are a handful where screening tests are absolutely appropriate. In other words, folks who have no risk, who have no symptoms, no complaints, but still need to be checked for these things. The tests are incredibly reliable, and so we can use these to screen. Blood pressure is a very common one. You get your blood pressure taken pretty much every time you visit any provider. But we're also going to talk about diabetes, hypercholesterolemia, or high cholesterol or high lipids. aortic abdominal aneurysm, which I'm going to refer to as AAA from here on out, osteoporosis or thinning of the bones, depression and anxiety are high on folks' radars right now, and hearing checks, especially for us as we get older. So hypertension, it's recommended by the USPSTF that everyone over the age of 18 is screened for hypertension. No interval is published, but again, because this measurement is done so frequently, the understanding is that yearly is probably the best thing. Now, there are some guidelines for pediatric patients, so our children are also being screened for hypertension, and your pediatrician can talk about what that means. They have a different set of values in terms of what's normal for the different ages between 0 and 18. We do also recommend that if there's a suspicion of hypertension, if it's possible to get readings of your blood pressure outside of the office before we start treatment, then that is recommended. Now, that doesn't often happen. Sometimes that's hard to do, and we want to go ahead and get you taken care of instead of waiting. But that option is out there because of the phenomenon you may have heard of called white coat hypertension, where folks' blood pressures automatically go up when they walk into the doctor's office just because of everything that's going on, the busyness, the hustle and bustle, maybe a little bit of anxiety there. Let's talk about diabetes. So again, another pretty frequent test that folks get done a lot. Sometimes you may find that your insurance company doesn't cover it because you don't fall into one of these screening categories, but for the most part, it's pretty easy to be screened for diabetes. We used to do that by doing a finger stick and just looking at what your sugar is either after not having eaten overnight or 2 hours after. We now can check something called the hemoglobin A1C, which is actually an average of what your sugars have been over the last 3 months and really gives us a better idea of overall how your sugars are doing. And you don't have to be fasting for that test. So the USPSTF recommends screening for prediabetes or type 2 diabetes in all adults over the age of 35 up to 70 who are overweight or obese. So being overweight or obese is its own risk factor for diabetes. And so that automatically would be covered by your insurance, automatically be ordered by a provider so that we can screen for diabetes there. The other category of folks who automatically get screened are women who had a history of gestational diabetes during pregnancy, and they should be checked about every 5 years. In general, I will tell you that while it's not listed under the USPSTF, certainly the American Diabetes Association supports screening everyone over the age of 30 for diabetes. And providers generally tend to check folks for diabetes or screen for diabetes in anyone who has risk factors for heart disease. So maybe, there's abnormalities on their kidney tests. Maybe they have a family history of someone who had a heart attack. Maybe they have some peripheral artery disease. Maybe they have high cholesterol or high blood pressure or a smoker. Anything that puts them at risk for cardiac disease, we're also going to make sure that we've evaluated that person for diabetes. Now, if you have diabetes or prediabetes, of course, we want that to be managed perfectly. And so presuming that we are able to get a patient to a place where their diabetes is managed very, very well, there's still maintenance tests that need to be done. So there should be a hemoglobin A1C done anywhere between every 3 months to 2 years. It kind of depends on where you are in the process of getting things under control. Obviously, in the beginning, when we're starting to get someone managed, we're going to check it more often. But if someone has been managing their diabetes for a very long time, not had any problems, their sugars are under control, then we might space that out to every 1 to 2 years. We also need to take a look to make sure your kidneys are not being impacted by that diagnosis of diabetes. So a yearly urine test or blood test to look at kidney function, that's called a micral or a B creatinine, is done. Absolutely everyone with diabetes should have a yearly eye exam, and that might be with the ophthalmologist or it might be an eye scan that's done in some primary care offices where we get a great look at your retina, the back of the eye, and the vessels leading to it to make sure everything looks healthy. And then we generally provide a foot exam at every diabetic visit. So every diabetic checkup, we want to make sure your feet are doing well. For those of you who have had to manage your diabetes, you know that there's a high risk of developing either nerve issues in your extremities or peripheral arterial disease, which means that you have less sensation in your feet. And so when you have trauma to that area, you may not be aware of it. And you may, your doctor will test to make sure you still have intact sensation so that you can be aware if there's a problem going on with your feet. Let's talk about high cholesterol or hyperlipidemia. The USPSTF recommends that we screen women aged 20 to 45 and men aged 20 to 35 for lipid disorders if they're at increased risk for coronary artery disease. So this is another one that most people tend to find a way to get their cholesterol checked, regardless of their risk. And insurance may or may not cover that. Screenings can help with that. But anyone who does have diabetes, hypertension, is overweight, is a smoker, is sedentary, high stress, family history of heart disease, any risk factor for heart disease, we're going to check that cholesterol. There are a number of different kinds of cholesterol. And so you've heard of good cholesterol and bad cholesterol. We have more and more values that we're able to check and monitor each year, it seems. And so your provider will walk you through your cholesterol panel and what it means for you and whether there needs to be any dietary and exercise interventions or even medications. Let's talk about that AAA, the abdominal aortic aneurysm. So the USP, now what this is that very, very important vessel that runs through your body that's bringing a massive amount of blood to your heart is called the aorta. And an aneurysm just means an outpouching of that blood vessel. So think of it sort of like a balloon that doesn't have a lot of strength in it left. So it gets pretty floppy. And you can see here a picture of a healthy aorta, nice and firm, not too stiff, right? That's what high blood pressure does. And then another one with an aneurysm. So you can see there are areas that sort of balloon out. What this means is that the blood isn't getting to the heart as efficiently as it should. It also means that blood can pool sometimes in these areas and cause clots that can shoot off to different parts of our body. And worst case scenario, it can actually tear or rip the blood vessel if it gets too floppy. And of course, that's tragic and highly emergent. So the USPSTF recommends a one-time screening for AAA with an ultrasound in men who are between the ages of 65 and 75 who have ever smoked. In fact, the recommendation is if they've smoked more than 10 cigarettes. So that's essentially ever smoked. Now, the reason this recommendation is just in men is because the USPSTF uses the data that they have to figure out the best risk to benefit ratio of the test. And it turns out that because this is a higher cost test, to use it sort of, on all comers, on anybody, we're really not going to get a great bang for our buck here. And we're really not going to pick up on abdominal aortic aneurysms in enough people to make sense to use this as a screening test. However, men who have smoked, who are older, between the ages of 65 and 75, are at high enough risk for a AAA that test actually may pick up enough of these that it's worth having that done. If you're concerned about this and you're not in this screening category or you have a family history, talk to your provider and see if it makes sense to go ahead and have that ultrasound done for screening. All right, let's talk about thinning of the bones. This is another recommendation for women, although men can experience osteoporosis as well. The USPSTF recommends a bone density scan, often called a DEXA scan, in women ages 65 and older, or in women who are younger than 65 years who may be at high risk. So this tends to be women maybe who've had a family history of osteoporosis, women who are slight and haven't had a lot of tension on their bones. That's part of what makes our bones nice and strong is the gravity and the tension that our body puts on them. So this DEXA scan will show us whether those bones are thinning or not. And they'll give us kind of a ratio of the significance or the severity, of that thinning. What we do from there depends on that severity. And so some folks may be put on medication. Some folks may be encouraged to do weight bearing exercise. Some folks may come back in 5 years for a repeat scan. So you start with that first scan, and then the plan changes for each woman based on what you find from those results. Now, let's talk about depression and anxiety. Certainly always been very important in the primary care world to look for and help our patients manage depression and anxiety. But over the last couple of decades, and especially in the last 5 years, there's been such an emphasis on the increasing rate of depression and anxiety, especially in our young people, that we have real evidence-based recommendations now for screening, meaning someone may not say to you, I have these symptoms and they feel like depression. I have these symptoms and the provider determines them to be anxiety. They may not mention anything at all. They may or may not have depression or anxiety, but we're going to screen anyway. So the USPSTF recommends screening for depression in adolescents, and that we do through a screening questionnaire. It can be anywhere from 2 to 9 to 29 questions. The USPSTF also recommends screening for anxiety, but even younger, starting at 8 in our children, which I think tells us a little bit about where we are in our society and how prevalent depression and anxiety are. Concerning adults, the USPSTF recommends screening for depression in all adults, including pregnant women and especially in postpartum women. There is not a statement around screening for anxiety, but most providers do the two together. It makes sense to do the two together. Now, again, as a screening tool, it means no one has presented to us with any symptoms. We're just going to ask. So don't be afraid if your provider starts asking you questions about your mood, about your stress levels. This is not because they've sensed anything other than they know it's important to find out if you're doing okay. And then finally, let's talk about hearing loss. This is one that I feel strongly about and really encourage folks to take seriously. For folks who are over the age of 50, they really should have a formal hearing evaluation. Now, when I say formal, that might be in with your primary care provider, doing some very basic tests, hearing tests beside your ear, okay? Or it may be being formally screened by an audiologist, where you have the headphones on and you lift your hand when you hear the beep on that side of in what ear. It turns out hearing loss is so prevalent in folks over the age of 50 that most of us are walking around with some degree of hearing loss after that age. So being screened so that you can have intervention is a huge quality of life issue. So don't forget this one. We think about the cancers, we think about hypertension, diabetes, high cholesterol, but don't forget about hearing loss and make sure that if you're over the age of 50, you're being screened for that as well. Now let's wrap up with immunizations. Seems like there's more and more out there, right? The best resource I can give you is at the end of this presentation, and that is our immunizations CDC chart that has all of the details about who should get what immunization when. In terms of adults, it obviously tends to thin out a little bit. Our kiddos get a ton of immunizations, but we really want to talk about, as an adult, making sure you're getting that flu vaccine. COVID is likely going to be recommended as a yearly seasonal vaccine, just like flu. The pneumococcal vaccine after the age of 65 or younger, if you're at high risk. There are several different kinds of pneumococcal vaccines to prevent pneumonias. You'll want to talk with your provider about the one that they provide and when and how often you should get that vaccine. I should also mention at this point that there's just been approval. Today is May the 4th, 2023, for an RS vaccine in adults over the age of 65 that'll likely be on the market by the fall respiratory season. Shingles vaccines are very important. They can have side effects after you've gotten them of just malaise, fatigue, tiredness, muscle aches, but incredibly important to know that that 1 to 2 days of feeling a little run down is well worth it given the shingles risk. And so having shingles, if you've known anyone who's ever had shingles, it's incredibly painful. It's long term. So getting the shingles vaccine is highly, highly recommended, and it is 2 doses. You can start at the age of 50. You want to get your diphtheria, tetanus, and acellular pertussis vaccine every 10 years, especially that tetanus piece for those of us that are older, and then any kind of catch-up vaccines that you didn't get when you were younger, and your hepatitis vaccines. So what are some of the other things that your provider may do or screen for that aren't necessarily in the USPSTF recommendations or the specific college of recommendations? So like, for instance, our cardiologists or our GI docs or our endocrinologist recommendations. So they should be asking you about your health habits. So how is your nutrition? How is your physical activity? Are you a smoker? How is your sleep? What are you doing to engage in hobbies? Those kinds of things, because those are great screening tools for interventions before a disease state occurs to get you into healthy habits. They may do other tests to screen for coronary vascular disease based on your risk. So if you, for instance, had several members of your family who had heart attacks at young ages, they may do some extra things. They may do something like an ABI, which is an ankle brachial index, where they measure the blood pressure in your ankles and compare that to the blood pressure in your upper body. There are all kinds, there are calcium scores, other kinds of screening tests that can be done for folks who are at higher risk. We're going to be asking about weight and doing measurements around body size and mass. BMI is a common one. Waist circumference is a common one. The up and coming one is relative fat mass. And so all of these types of measurements give us a sense of what your future risk could be. They might be screening you for risk of hepatitis or HIV. So there may be a sexual activity questionnaire. Maybe have you had blood transfusions? Those kinds of questions to make sure you're not at risk for those infectious diseases. They may talk to you about tobacco use, but also alcohol and other substance abuse, as well as intimate partner violence, because we want to make sure that everyone is safe, that they are not engaged in addictive behaviors or substances, and that they feel safe in their own homes and others in the home feel safe. And then they may dig into your what we call social determinants of health. It's all well and good if you visit the provider and they have a great idea of what your health status is, and they make all the recommendations based on that and your age and gender. Here are the screening tests we have. Let's make sure everything's looking good. But if you're struggling with transportation or food or safety, finances, understanding health then none of that is going to be useful to you. So our providers are really beginning to take a look at what life looks like for you and accommodating their recommendations to your needs. Those are some of the resources that I mentioned you could take a look at. We've got that USPSTF page there. We also have our vaccine page for kids and adults, specifically that pneumonia vaccine table, because it can get a little tricky if you're interested. And how can we help you at Employer Health Services? Well, first of all, we can always help connect you to a primary care provider if you do not have one. Your primary care provider is going to be sort of your cruise director for getting all of screening tests done and ordered. We also provide health coaching. We provide screenings where we may identify some of these things like high blood pressure or high cholesterol, so that your employees or you know what your risk is. We provide all kinds of programming to help with some of those risk factors that may turn up, such as weight loss, poor diet habits, lack of physical activity, high stress, or using tobacco products. We can set you up with some of those cancer screenings as well. So we do have mobile mammography that we partner with. We can help your employees get their breast cancer screening taken care of. If you have an on-site clinic or are interested in having an on-site clinic, our nurse practitioners can do these kinds of wellness visits where they ask all of these questions and they close all of these care gaps. If they see someone has not had their colonoscopy, they're going to get that squared away for them. If they see someone had diabetes when they were pregnant but haven't had a hemoglobin A1C checked, they're going to check that. And then finally, we can hold vaccine clinics as well for any of those vaccines that you see there mentioned. We want to help you because we understand that the key to your success is the well-being of your employees. So we want to help you here at Employer Health Services. Please reach out to us if you have any questions. I hope this was helpful, and I will see you again in a couple of months. Thank you.